When it comes to doctor's visits, you already know the drill. Arrive early, bring your health card. But there are ways to make the most of your appointment. And Dr. Adam Kassam is here to give us the inside scoop. Doctor, welcome.
Nice to be here.
Let's dive right in, because people really want to know this. They're really interested. What's the best day to visit the doctor?
So we know that Tuesdays to Thursdays are actually the best days to visit the doctor. And part of the reason why is that patients will sometimes get sick. Often on the weekends, they try and tough it out. And if they don't get better, then they call Monday morning. They want an appointment. So we know that the Mondays are usually high volume days.
People arrive early, but then they end up having to wait to see their doctor. So how can this be avoided?
So this is a very good question. We know that the most efficient appointment times are actually the first appointment of the day and the first appointment after lunch. Okay. And the reason is that there aren't any patients before then, usually, which basically help to eliminate the backlog.
Well, talk to me about some common mistakes that people make when they get to the doctor, before going to the doctor.
Yeah, so I would say that the first thing that we would want to have patients understand is not to drink any caffeinated drinks before visiting your doctor.
Okay, why?
So
you're getting me right here, Doc.
I know. So caffeine elevates your blood pressure, it increases your heart rate, and when you're getting your vitals taken, we don't want there to be falsely elevated values that we're then misinterpreting or treating or diagnosing. And so if you can avoid that coffee, that tea, that energy drink, that would be wise.
But see, like, I think I could go into the doctor and say, I've had my 2 cups of coffee, this is now the baseline, right? And use that as my normal, because that's always my normal.
I mean, if you're guzzling coffee, then and that's your baseline blood pressure, then maybe that's a good way to do it. But if you can avoid it, that'd be great.
When visiting a doctor, often people have more than one issue that they end up asking the doctor about. Some doctors are okay, but others don't necessarily like it. So why is this, and what do people need to know?
Yeah, so I think the important thing to realize here is that different doctors will spend a different amount of time on different issues. So for example, if a loved one is suffering from dementia and needs an assessment, that usually takes longer than seeing someone for the common cold.
Sure.
And so a good rule of thumb really is to ask your doctor in advance kind of what the amount of time they usually have for different types of visits.
Right. Okay, no, and one of the issues that I have is typically in between my visits, I'll recognize that this hurts or that seems to might have a rash or something like that. And I try to make a mental note of all the things I want to talk to the doctor about. Sometimes I'll end up forgetting 1 or 2 of the things on my mental list. Is it appropriate to email the doctor in a follow-up after I've seen him or her?
So that's a good question. It really depends on your doctor specifically and your relationship with that provider. Some doctors will kind of triage it through their secretarial staff. Some will have a sort of a more personalized relationship. So it really depends on your relationship with your doctor.
But communicating with the office to say, I forgot to mention this. If they want to bring it to the doctor, they can. But there's nothing wrong with emailing the office itself.
Absolutely. I think that's a reasonable thing to do.
Now, when it comes to booking with a physician, how much advance notice should we be giving?
So I think it really depends on what the issue is that you're concerned about. So usually for annual health visits, doctors typically will book about a week to a month in advance. Okay. For more specific issues or if there's something more urgent, you can usually get in to see them a bit quicker than that.
What about the best time of year to go see a doctor?
Yeah, so we know that the summer months, believe it or not, are actually the best times of year. And part of the reason is that patients are either with their families, on vacation, or out of town. It's also not flu season during that period of time. So November to March tends to be pretty busy because of that.
Finally, I've just talked about my mental list of questions that I have for the doctor, but what are some questions that everyone should always ask?
So this is a very important point. The first question that everyone should ask before leaving their doctor's visit is when they want their doctor to see them back next. The next important issue is when they should be hearing back from a specialist appointment or if they're being referred for blood work or other imaging, why those are happening. And then the most important probably question to ask is if you are coming to see a doctor for a specific reason, certain symptoms, if those symptoms don't get better, what you should be doing moving forward is an important question to ask your doctor.
Doctor, all useful tips. Thank you so much for being here today.
Thank you so much.
All right.